Hi, my name is Tara Talbot, student number T007-45663, and I'm going to be demonstrating the equipment we need for a male canine urinary catheterization. So first off, I'll start with the catheter. So this is the red rubber catheter that I chose for our medium-sized Labrador. It's an 8 French, so another common size would be a 10 French, but for my patient, I'll be using an 8 French for him. It would be preferable and the gold standard to use sterile lube. We don't have small packets of sterile lube in our clinic, so I have a brand new tube of lube instead that hasn't been used. If I had that, I would use that instead. And then I have my chlorhexidine scrub for aseptic preparation. I have some sterile saline that I pre-measured here and wrote on there, sterile saline. I drew that up half an hour ago. And then I have some gauze, and I would have warm water as well in here. My gloves, and then I have 3 and 6 ml syringes to help draw out the urine from the bladder, an extra kidney dish, which would ideally also be sterile, but I just touched it with my hand. I did wash my hands though. And then I also like to have a towel in case some leaks happen. And then I have my urine collection containers here. So I have this container or a vial. Yeah, so then talking about the procedure. So first you would want to prepare all the equipment. That way the dog isn't waiting and being stressed with you doing that. And then you would measure by having this at the tip of the prepuce, going up and around kind of towards their anus, and then up past their hip joint and between 5 to 10 centimeters in front of their hip joint. So it'd kind of curve around like that, inside the animal, obviously. And then you would wash the prepuce, just the prepuce, using the Chlorhex scrub and gauze, and you would be going this and little. So I'll be doing small circles while doing big circle, and going around, and you want to do that at least 3 times on the prepuce to make sure we remove any debris. And then I would go and wash my hands for at least 30 seconds, ideally a minute, and then put my gloves on. And then that is when I would open up our urinary catheter. You can also have an assistant help hold it so that you could apply the sterile lube. And then, so the dog, you can have 1 or 2 assistants, but the dog would be laying in lateral recumbency. I'm gonna guess with the legs towards me. So I have the and the head here, legs towards me. So then I would externalize the penis, and then I would rinse that with my sterile saline to get rid of any debris that may have been inside the prepuce. And I wouldn't leave the needle on there. That's just to make sure it stays sterile. Yeah, and then you very gently and carefully insert the urinary catheter into the urethra. And how far that I would go would be, I would know because I measured it from the prepuce around and about 5 centimeters in front of the hip joint. So I would kind of have a visual mark of how far I would need to go, and go about until that mental mark that I have on the tube. And you should be having some urine come out, maybe not. Sometimes you might have to use the syringe to get it to come out. Sometimes it will start coming out on its own. I could collect the first couple mils into the kidney dish. That way it helps get rid of any bacteria. It's just like catching a midstream sample. So after a couple mils are taken out, and then I would collect my more sterile sample, either into the urine container here or into the urine vial. And then you would very gently, same thing, gently remove the catheter, and in between your fingers and while holding the prepuce, because you do not want it to just whip out and have urine go everywhere. The dog may continue to pee afterward. If not, it's nice to take them outside to go to the bathroom after. It can be a weird feeling for them. So yeah, I would remove that, and then I could rinse the dog again with some saline, help clean him up if any urine got anywhere. Yeah, and then we would be done with the dog, and then I would come and label the sample with the name, patient name, date, the time it was taken, what it looked like at the time it was taken. Sometimes refrigerating can change how it looks. So like the turbidity, whether it's cloudy, and the color as well. At the date, my initials, the clinic name, yeah, I believe that's everything. So yeah, that's how this is all the equipment that I would use for a male canine urinary catheter, and that's how I would do the procedure. And thank you.